some information about the patients coming back from the health information exchange. And the immunization registry is going to be on that exchange as well, so you'll see that information hopefully really soon. It's done being tested now. And then e-prescribing, which I'm sure you guys have been doing here for quite a while, right? So 4A is the self-care process. So you are actually using the EHR to provide educational resources. That's a meaningful use item number one, if you've done that one. The 3, develop and document self-management plan and goals. A lot of times we don't do a good job of that, but it's something that takes some time. So when you're looking at just basically these 2 conditions plus the third, mental health or unhealthy behaviors, that we develop a self-management plan that we can use across the board for specific diabetes patients, and trying to make sure that we understand if they're able to manage their care. Do they understand the medications they're taking? Do they understand how the diets are very important and things like that? And a lot of these types of items we can document by using your website. If you have information, educational information on the website, we'll use that to kind of show how we back up what we've talked to our patients about. So we'll have that documentation there as well. And then the other part's pretty self-explanatory. It's measuring it through the reporting that we can get through meaningful use for that particular element there. Counseling patients on unhealthy behaviors and mental health abuse and stuff like that. So then we get to the referral tracking, and this is the piece that coordinates with the specialist, right? So is this electronically being done? Do you guys electronically send out referral? Well, you don't. You refer internally, right? So,
Yeah.
how does the other side? How internally do they know that you're sending somebody to the specialist?
It goes to the referral, and we open a template, goes to the referral staff.
Okay.
And they take it from there and send it to the secretary, I think.
Okay. Okay. So you're able to then manage that whole referral process a lot better than most, because it's all here. So that shouldn't be. Is there anything that you've seen that is concerning on the referral side?
I think for the outside referrals, it's
Yeah.
just making sure those patients are showing up and that we're communicating back to those offices. If the patient doesn't show up, they refer to us.
Okay. How are you getting the reports back from those outside? Say any old way, right?
Well over
Right.
50%
They
of
send her
requests
letters.
to get,
Request.
all day long, I request to get reports from the specialists for us information.
Yeah. So one of the things that they ask about here, which is interesting, is whether or not you have sort of a referral agreement outside of your practice. So, and that's it's informal. It's about, you know who you're sending your people to. Maybe it's the specialist for cardiology somewhere. And you would just, as an organization, send some letters out to these folks that you've been dealing with for a long time. And you're going to say to them, we appreciate that you work with us on your patients. This is what we expect back from you. Because a lot of times we never actually put in writing what we expect. So if we send you a patient, could you kindly send us back a report in a week or 2 or whatever your deadline may be? And then we need that for an element here. But we also need that so that we've done that official communication to those folks. I mean, that's the way that they're getting patients. They're getting patients from you. So you expect that back. There's a couple of electronic systems that they're using. I know over in Raleigh, one of them, Infina, that actually is electronically doing referrals back and forth, and it's timing them so that if you send something out electronically to somebody across the way, if they don't come back to you, then your referral person's getting the notification that there's nothing happening here. So then they're reaching back and doing. So it's an electronic way of referring. Referrals come in all kinds of ways. I mean, some people are still handwriting that I sent somebody to someplace and that type of thing. So it's kind of hard for some practices. But with your organization internally here, you could concentrate this 5B on what you do internally, because I would assume that your outside referral is probably pretty low. And so you don't have to really concern yourself too much with that, because you do it all internally here is where I would focus that. There's nobody asking for that except for the 50% of the referrals, and I would assume you can meet 50% referrals internally, so then you can manage that a lot better than most people do, because you can imagine how hard this is for people that have no stake in the game outside their organization. So I think we're pretty good on that. And then this is the final one, so this is the quality improvement. So we're gonna set some goals, and I say element, I don't think I have them on here, but we're gonna set some goals to improve on some elements, and the team here is working, I guess, on that. Basically, like I said before, these can be things that you've already, have you done any kind of quality improvement recently? Has there been a big deal that you've worked on? Anybody had any kind of projects that they've done? Obesity, have you done obesity before? Have you done, do you do flu shot clinics, flu clinics? Okay, so there's one, right? And so do you ever measure that maybe last year you did this many shots and this year you did this many, and how many people did you miss, and that type of thing? It's as simple as something like that, right? So we did a flu clinic last year, and we did we did enough vaccines for this many of our patients. This year we did it again, and we had this. And then you could actually still, I guess we could still give shots now, if you still have them, influenza shots.